Hello and welcome to the Dementia Dish. My name is Danielle Farrell and I'm one of the public education coordinators at the Alzheimer Society of Peel. And today I'd like to bring to you the dish on personal care and grooming. As dementia progresses, bathing, personal care, grooming, and hygiene, these are things that can be highly affected by the disease and its progression. And people living with dementia may experience a wide range of emotions when it comes to personal care and grooming. So a person may experience frustration, they may experience embarrassment, and as a result of these things, the person may have protective responses. And these responses can be verbal or they could be physical. Because when we are providing personal care to someone, we are in their personal space and we are attempting to assist the person with something the person has always done independently for themselves, usually in the past. And so there are some things that can happen as a result. So why might a person living with dementia experience some concerns and difficulty around receiving personal care? So one would be the dementia progression. So very simple tasks may be forgotten or become very difficult for the person as they experience brain changes. Sequencing, memory, coordination, balance, problem solving. These are all things that the person living with dementia may have change for them based on their brain changes. So as a result, the person may have a great deal of difficulty carrying out the tasks that come along with personal care. So bathing and toileting, dressing, grooming, all of those sorts of things. People living with dementia may also experience, as their disease progresses, depth perception issues, whereby they have difficulty telling how deep or how far things are from them. And so a tub full of water may actually cause some fear, where the person can't tell where the bottom is and therefore may have some fear of drowning. So fear is a really big emotion that can come along with personal care as well. With the forgetfulness, the person may actually forget how to use some of the objects that are used in personal care. So how to use their comb or how to use their toothbrush. The person living with dementia may not be feeling comfortable in their environment. They may feel that the environment is unfamiliar. They may not be very comfortable with receiving assistance from other people around personal care. That is something that is very intimate and something that most of us have always done independently. So it's very hard to accept those changes. The person may actually be experiencing a symptom called anosognosia, meaning that the person living with dementia is unaware that they need help. They are unaware, they lack insight into their disease, and that the disease is even present, and that the disease is causing changes in their ability to do things independently. So the person may not see the need for the assistance. Also, the person's previous bathing routine, so how often they bathed and what their grooming routines were in their younger years, may not be the same as what we are promoting as the new routine now. So that may also cause some resistance to allowing some help and to bathe on a regular basis. So there are some things that we can do to help a person living with dementia to be a little more successful when it comes to personal care. So one of them would be that when we're talking about bathing, so a shower or bench chair in the shower can really help for the person to feel more secure, less concerned about falls and slips, so less fear. A handheld shower wand may allow the person to feel more control of the water being used on the body, but not necessarily poured over the head, which can sometimes elicit some fear responses as well. Rope bathing is something that can be tried and utilized. Rope bathing is where a person, instead of being completely exposed while bathing, they wear a rope. So a rope that could be washed and dried, so something that can get wet. And the person wearing that while being bathed. And the person, you would expose just one section of the person's body, clean that area, put the rope back, and then do another area and put the rope back so that the person never feels completely exposed. It helps with embarrassment, and it helps with that dignity piece. Sponge baths may be something that can be used instead of full baths when there is that resistance. It's going to be difficult to get a person to bathe. Maybe we can do some sponge baths in between. If there is really a fear of water, then rinseless shampoos and conditioners and body washes can be purchased. And these products can really deodorize and clean and cleanse the skin and hair without the person having to be immersed in water. So that might be a helpful tip. If the person has always dyed their hair in the past, you can buy colored shampoos in different colors. And it might help to tell the person that it is dye, that it is a dyeing process. You're going to be dyeing the hair. And that might help to get some buy-in around washing hair. You want to maybe heat the water first, get all the products you need into the bathroom, have those things right nearby, and just get the setting to be in a way that will make it really comfortable for the person. The other thing you might want to consider is a contrasting mat or towel that you put at the bottom of the tub. This helps the person living with dementia that has those depth perception issues to know where the bottom of the tub is. I wouldn't suggest any black or brown. Black or brown may look like a hole perception wise to the person living with dementia's brain. So we probably don't want to use those colors, but a contrasting color to the white tub. So in the picture here, we have a blue. Toileting is another area that can be difficult sometimes. And so here are some tips and strategies for that. So the use of a commode or a raised toilet seat can definitely help for people who are having those mobility difficulties. If you have a person living with dementia who, when seated on the toilet, keeps trying to stand up, and before they've voided or use the toilet, then you might want to put a little stool underneath the person's feet so that the person will stay seated and not be as likely to attempt to stand. If the person living with dementia during personal care, including toileting, grabs onto you or grabs onto things, then it might be helpful to give the person something to hold in their hands before assisting them in the washroom. And that could be a towel or a face cloth or some familiar object that is comforting to the individual. If the person living with dementia is taking off their incontinence briefs, because maybe those incontinence briefs are unfamiliar to them, like the concept of them, then putting regular underwear over the incontinence brief can be a way to assist with that. You can also put colored water in the toilet. This helps the person be able to perceive where the water is in the toilet and to aim. And also a colored toilet seat that is a contrasting color to the white toilet can also help the person to be able to perceive where to sit and where the seat is compared to the toilet. People living with dementia can have where their brain perceives two things of the same color tone to be one item and not to be able to differentiate. So that would really be quite helpful. If the person living with dementia is in the bathroom and they are triggered by the mirror, meaning that the reflection in the mirror, the person is thinking it's extra people in the washroom with them and is upset by that, removing the mirror or covering the mirror would be a good option. There's also some silicone soft grip tools that you can purchase that can be attached to grooming tools like your toothbrush, your brush, for example, and that can make it a lot easier for the person living with dementia who is having mobility issues to be able to hold on to those items and use those items independently. For oral care, there are some tips and strategies. One would be to switch from a regular toothbrush to an electric toothbrush. The reason for this is that the electric toothbrush will be a little easier for the person living with dementia to hold, as well as to get a better cleaning job done. Dry mouth, which can be caused by medications, and maybe not drinking as much fluid as in the past because forgetting to drink. So sugarless candies, sugarless gum, ice chips, fluoride swabs. These are all ideas for the dry mouth as well as to promote better oral care. And using gestures about using a toothbrush. So here's your toothbrush, putting it in the person's hand, and then you make the gesture of brushing teeth to help the person to be more independent to use that toothbrush. For skincare, damp cloths or wipes for the hands or the face. So if you're having difficulty getting the person into the washroom to wash their face and hands, perhaps bringing wipes or cloths, damp cloths to them to do it wherever they happen to be at the time, as opposed to trying to encourage into the washroom. People living with dementia, as their disease progresses, will be more at risk for skin breakdown. So lotions and creams can be a really great way to help protect the skin. And if the person liked certain scents, aromas from their younger years, so for some people, maybe, for example, it might be lavender, then getting something with that scent can also be very soothing and calming. You can use the creams and the lotions to give a little massage to the person's hands or arms, their feet, their legs, as a way to sort of encourage them to want to have the lotion and the cream applied. For hair care, keeping the style simple. So the simpler, the better. A lot of people have attended regular hair appointments over their lifetime. And so keeping up a regular hair routine with appointments to the hairdresser, that might be helpful, hairdresser, barber. Gesturing to show how to use the brush or comb. So again, the person may be forgetting how to use these items. So if you take a brush yourself or a comb yourself and you show how to use it and then hand it to the person, that may make it easier for the person to be independent. For shaving, if shaving becomes a difficulty, then switching to an electric razor is often safer and a great way to still promote independence. And if that fails, then perhaps no longer shaving and going to growing a beard, for example, might be a better option. So if you'd like to reach out to the Alzheimer's Society of Peel, you can do so by contacting us at our phone number at extension 307 or emailing our service access department. And you can follow us on Facebook, Twitter, Instagram, and YouTube. And it would be wonderful if you could subscribe and join us for future dementia dishes. Thank you so much for joining me today.